Okay, thank you guys so much for coming out today to the Migraine Overview Seminar. We're going to talk about 30 minutes about chronic migraines. I'm Tina Shropshire, your friendly family nurse practitioner for the clinic. Okay, so migraines, what do we know about them? What do we think? You guys jump out. Come on, help me.
When I get mine, I get blurred visions, bright light hurts me.
Okay.
I turn up the dark. Sometimes I get nauseous.
Okay, what else?
Debilitating. You can't do anything.
Debilitating.
Yeah.
It is debilitating, right? And so it's hard to take somebody off work when they have a migraine because you look at the person, they look fine to their supervisor, but it's internal, and it's one of these things that it definitely can affect you. You don't know when it'll hit you. Sometimes you'll know your triggers, sometimes you won't.
I always know, well, not always, but it looks like it's snowing glitter.
Yes.
Oh, wow. Okay.
And that's a sign that,
A trigger.
yeah, and I know to take something right away.
Right away.
To try and,
Yeah. The quicker that we can get it turned around, the quicker it'll stop. We know people can have migraines from a couple hours to a couple days, right? So, I hate headaches. I cannot imagine having a headache for days, and sometimes people will. So the migraine definition is a recurrent throbbing headache, okay, that typically affects one side of the person's head. It is often accompanied by nausea and vision disturbance, like the young man said. So usually it's like zit, 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 zit type of a headache. It can be pretty common, right? It can affect your nervous system, so it can be like a tingly kind of a stabbing pain. The burden of migraines is the most burdensome thing because for the fact that the patient is going to have to spend a whole lot of money, might have to miss work. It can affect your day-to-day life. It can affect your relationship, your ability to focus, to do your work, anything. So it remains underdiagnosed and undertreated, right? So there are about 36 million people who suffer from migraines, and about 27 million are females, and then 9 million are males. Why do you think females have more migraines than males?
Because they put up with the male.
Because we put up with the male. That's the answer. That is the answer. Because we got so many more hormones. So some women might notice, like around their menstrual cycle, like is starting might give them a migraine, during or after might give them a migraine. So their hormones are fluctuating a lot more than obviously males don't have estrogen, don't have progesterone to give them issues, right? So nearly 1 in 4 households will have at least one person who has migraines, and usually it happens around the age of 25 to 55 years old, right? So migraines actually affect more people than asthma and arthritis. No, or asthma and diabetes combined. More people who suffer from migraines. So, like I said, it costs over $2 million a year, direct cost. Indirect costs, 13 to 31 billion because you're missing work, you're not as effective. It's terrible to not be in good shape to be able to like go out and do things with your kids, your family. All you want to do is kind of lay down, be in a dark room. How can you do that and work? I don't know how some people work through migraines. So individuals with migraines can also have an altered neuropsychological response between attacks. So like you had your attack, let's say it lasted 3 hours, you very quickly took something to get rid of it, and let's say your next attack isn't until next week. But you can still have sharp stabbing pains, right? You can still have visual problems and auditory problems. So your migraine's gone, but you're still having those residual little migraine effects. Have you guys had that in between? Yeah? No fun. Right? So there could be absolute triggers, okay? So can you guys name some of your triggers? I know for sure lack of sleep and stress really stand out. Caffeine, not having it or having too much of it, right? Skipping meals, and then physical or like emotional, What would you guys say triggers any headache or migraine for you?
I would say caffeine for me.
Lack of caffeine, yeah, okay. Anybody else have any triggers?
Nothing over. I don't know what triggers mine.
Gotcha. I mean, it could also be like one guy, he was getting sick and throwing up, like just from the smell. Different smells will trigger migraines, or different loud sounds can definitely bring on a migraine. So working in a really loud plant sometimes could be part of it. Different allergies. So maybe you're having a pet or something that is causing, mold. Maybe there's mold and it's causing you to have like a migraine trigger. So if you don't know what your triggers are, you're having an unexpected migraine occurrence and it's out of the blue, you've gotten good sleep, you've eaten, you had your proper amount of caffeine that you would, start looking for a trigger. What did I do within this last 3 hours before this started? Did you go to a new place? Sometimes people will have migraines just from those plugins, the little scented program, the fragrance plugins. That could cause a migraine because there's chemicals constantly being released into the air. So it also could be like a food sensitivity. It could be maybe something that you're eating that you don't eat that much that's causing you to trigger. Your body's like, oh, I don't like dairy or gluten. Those are my two things I always pick on. But it could be any number of things. It could be something that your body's like rejecting and it's causing you, our bodies talk to us, through a symptom. Usually it's like, I don't love this, but we just don't ever pinpoint back. That's why I always tell people, if you have chronic migraines, do a migraine diary, write it down. What did you do different? You can go back and look and track. I mean, I had these hot dogs. It could be a certain brand of something that you don't love, right? Okay, so migraine versus a headache. All right, so with a headache, you have pain around your forehead. It could be mild to dull pressure. It typically is short, right? It could be incidental, doesn't have any reason, rhyme. Usually you don't have to have like a whole lot of medication. There's not a whole lot of other symptoms. It's just a headache by itself. You're not nauseated. You're not having visual problems, okay? And it's treatable with something like rest, Tylenol, or water. When you're having a migraine, the pain is usually on one side, right? You definitely usually have like a throbbing, pulsating type of pain. You have some nausea. Not everybody has that, but most people do. It can last days. Regular headache does not last days, okay? You can have flashing lights, blind spots, and like she said, snowfall. And it's commonly reoccurring, so you can kind of predict it. You can kind of go, yeah, I'm gonna get a migraine here. And a headache, you just kind of, you can tell, I didn't eat that much. You'll really quickly know with just a regular general dull headache. It'll be like, yep, only got 3 hours of sleep last night. It'll really stand out to you. So migraines are more like an illness, and headaches are more like a symptom of an illness, okay? So clinical presentation for a headache with a migraine. So we're gonna look more like that one side here. A cluster headache is that stabbing. I mean, they say that people might even want to commit suicide. It feels like your eye wants to be, if somebody's pushing it out behind your eye. Tension, your head feels like it's in a vice, right? And then just your regular tension headache can be here too, like frontal. So you can get a headache in the back of your head, and usually that might be that you're having higher blood pressure, right? So migraines in particular is just like on that one side usually. Okay, so most people, as soon as they have one headache, boom, I want a CT scan. It's like, that's usually not how this works. First, CT scans and MRIs are not the cheapest tests in the world. Mostly if you're just having a migraine, or not to say just, because it is very, it's a big deal. But if it's only that, it's not caused by a tumor, more likely it's not, a CT scan is going to be negative for you. And then you went and you got this test, and you're going to get a bill, your deductible, all that fun stuff. So it's not the like, oh, I had, a headache and I need to go get a CT scan. You need to have some reasons, like, I am over the age of 50 and I have never had a headache in my life, and now I'm having a headache. Yep, that's going to require some imaging, right? Or a substantial change in your headache pattern. I'm getting these all the time, out of the blue, no triggers. I've done everything I'm supposed to take. I'm taking medication. It's not going away. You know what I mean? Yeah, let's get an image. Let's make sure we don't have something we need to be concerned about. Or if you have a history of seizures, then you definitely want to have an image done. Or if you're having like neurological symptoms, right? So like your speech is affected, your hearing is affected, your walking's affected, you're having numbness, tingling, shooting pain, then you definitely would want to have like a CT scan or an MRI. But it's not like I've been having headaches since I was age 20 and now I'm 55 and I've had one a week for the last 35 years. I need it's like, well, okay. So strategies for migraine treatment, right? So the very first thing is the quicker that you can get your medication in you, the better. So you want to stop the pain. Like once you get above a certain pain threshold, it becomes that much harder to treat it. So you get people in, it's like, I've had this migraine for the last 4 days. It's Thursday. Well, I've been here Monday, Tuesday, Wednesday. Why didn't you come Monday? You know, don't hesitate. Let's just try to get it taken care of quicker, because more than likely I'll see you Thursday and you'll be back Monday because you're still quite, you know, not where I wanted you to be. So if you can preemptively treat, like if you know every time I go to this certain part of the plant I'm going to get a migraine, if you could go ahead and take, or whatever, it don't have to be the plant, whatever you know that's going to cause it, go ahead and just take some medication preventatively, and then decrease your migraine frequency. You know, if you know that there's certain things that are going to trigger, like avoid those known triggers big time. Okay, so usually we're doing something like Motrin. That's kind of number one. Opiates. We already know that there's a huge opiate crisis in the United States. We know that people, kids, everybody's overdosing, and it's really, really hard to get opiates. So it's not really our go-to medication for people who have migraines. Honestly, it's really not what we want to use, but sometimes it is used. Worst case scenario. You have neuroleptic medication and anti-nausea medication, and then steroids. Sometimes steroids are used. You give a steroid shot. You can give a Toradol shot that helps to break the inflammation and pain. I love Toradol for migraines because it takes care of it within about 15 minutes, which we do have here at your clinic with no cost to you. So you could also do like this DHE. I have honestly never ever used it. Usually it's triptans. And so like sumatriptan and fun stuff like that. And they usually start working within 1 hour. Okay, you can have nasal injections in the muscle, and pills. So acute treatment, so like I said, early intervention. As soon as that starts, second one, go get your medication so you can get rid of it. Sometimes people want to let stuff go on and see where it's going to go. It's going to keep going. You can trust that. It's not going to just go right away. It'll last for hours. Use the correct dose and formulation. So a lot of times people think more is better, and they want to just go ahead and like, well, if they said, you know, take 2, I'm going to take 4. But then we get resistance, and then we get rebound headaches and stuff like that. So you want to follow the medication as is prescribed, right? And then use prevention, and we'll talk more about that. So sumatriptan, it gives you the doses of that. That's kind of like the most commonly used. And this medication is expensive, so we're not sharing it. We're not giving it away. The pharmacy will only let you get so many tablets, like in between 6 to 9 tablets. This is a very expensive medication, so we're only using it when we need to. You, like I said, you have a tablet, you have injectables, you have a nasal spray, and then you have a powder nasal spray. And all the rest of them are also in the triptan family, but the only one that you can get the different routes like that was sumatriptan and then zolmitriptan. Okay. So routes, like I said, oral is the most, commonly used. You definitely have the nasal sprays, injectables. I've never given an injectable besides Toradol and NSAID. Okay, and then you have suppositories. Sometimes somebody's throwing up so much that they can't take anything orally. And sometimes people have migraines to the point they're having diarrhea. Like it gets to be that bad. I don't know if you've have experienced that. So when you're taking your medication just however you want to, you can end up with this rebound headache, which is the worst, where your headache is going away and it comes back like twice, way worse than it was in the beginning. So you definitely want to make sure that you're using the medication as prescribed, because you can end up with like a withdrawal or a washout fill from overusing the medication. So one of my favorite things, non-drug management for migraines. Quiet room or white noise. Sometimes a little bit of soft noise in the back will help somebody, like a fan, but a lot of times quiet. Dim lights, like he was saying, no screens at all. So we're not having an iPad, a TV, nothing. A lot of times even the light for the charger on the cell phone, you cover that. And you just kind of lay back and relax until the migraine is completely gone. Cooler temperatures and fluids. imagining you don't have any medication, imagining, okay, so like we said, there's definitely a potential for drug abuse when it comes down to opiates. We could use a barbiturate. I actually really like barbiturates for this because they work really well, but there's a potential concern for overuse. They're not controlled. There's a potential for drug interactions, rebound headaches, like a headache caused by the medication, and then withdrawal. So I will prescribe like Ferrocet a lot for people who have tension or migraine headaches because it does work, but it's not something that you're going to be using every day, all the time. It has Tylenol, it has caffeine in it, so it's not meant to be used or overused. And sometimes the combination can include codeine. I've never once written it that way, but then that would be a controlled substance or opiate. So when to use, if you're having like a migraine that is interfering with your daily routine, despite like having a prescription, we use prevention. Yeah, so there are people who will go on like preventative medication. I like magnesium. Magnesium is from the earth. It's a mineral. You can use it without having a whole lot of weird side effects, and it's a smooth muscle relaxer, so it helps you to calm, it helps with sleep, it helps keep your bowels moving properly, and it also helps to prevent that migraine. So sometimes you'll tell people, look, take 400 to 500 milligrams of magnesium every night, regardless if they're having, like I said, migraines on top of having a prescription, and then also something that's interfering with their daily routine. Sometimes there are people who will go ahead, they can't tolerate the medication, or they have too many adverse reactions to sumatriptan or whatever medication they're prescribed. So you could put them on like a beta blocker or a calcium channel blocker or a tryptophan or SSRI. So there are medications for depression, which are tryptophans and SSRIs, and then there's medication for blood pressure and heart rate, which are beta blockers and calcium channel blockers. There's specific ones that help with preventing migraines, and that's somebody who's just consistently, no matter what you're doing, having one. Okay? So our goal would be to decrease the attack frequency, intensity, and duration, right? We want everybody working, we want everybody functional, happy, upbeat, We definitely want to improve your responsiveness to acute prescriptions, and improve your function and decrease the disability, because one of you guys said at the very beginning, they are disabling. If you're having a migraine, you're not at work, you're not really going to be able to be any good to anybody. Sometimes you can't drive, sometimes you can't even take care of your own kids. All you can really do is try to medicate it and lay down and drink water. You're out of it. So we would use, like I said, antidepressants, beta blockers, calcium channel blockers, NSAIDs such as Toradol, which is in an injection, sometimes can be prescribed in a pill. Also Motrin, Aleve, and then there's medication to help with your stomach if you're having vomiting. Okay, and then others would be vitamins, minerals, and herbs. So I personally love magnesium. Sometimes you have a low vitamin D. I'm giving you all these medications, hardcore medications, and it's just a vitamin deficiency. So we look at, is your iron too high, too low? Is your vitamin D too high, too low? It's almost never too high, only one person in life. Is calcium off? Is your magnesium off? Are you getting proper, fruit and vegetable intake every day? Are we eating a lot of processed food and not giving ourselves a real chance to have good nutritional balance? Are we not exercising? Are we kind of doing a sedentary life? Are we drinking a lot of beer, a lot of pop, a lot of stimulants? So I always like looking at the alternatives. So you're going to treat the patient, usually it's going to be patient preference. I always talk to every person, Some people are like, just give me a pill. Some people are like, I don't want any pharmaceuticals. I want alternatives. You got to see how the person's tolerating, see if there's any drug interactions in response that's going to determine what you're going to receive with your doctor or with me. Is the person pregnant or planning to become pregnant or nursing? And then if you have any history of overuse. Some people, you give them their medication and then like a week later, they're like, I need you to refill that. And it's like, well, we already had a month's supply like a week ago. Where is it? They used it all. So it's like, okay, well, you need another medication, number one. Number two, you need to be educated because this is not how this works. All right, so they like have a rating for like grade A and grade C. So relaxation training, thermal biofeedback with relaxation training, EMG biofeedback, and cognitive behavioral therapy are all effective grade A, so it's proven. Grade C would be acupuncture, cervical manipulation, occlusal adjustment, hyperbaric oxygen. I love hyperbaric oxygen. If you can afford that, it's not the cheapest thing I've ever come across, but where your body's getting oxygen at every cell 100% oxygenated for an hour, that helps with a ton of stuff. We can talk about it later if you should like. And then hypnosis. Just some alternatives for you, okay? So, questions, comments, concerns, thoughts? Anybody? I don't know. I mean, I think the best thing is going to be trying to prevent, keep a headache diary. That's huge because you don't know what your triggers might be. It might be that you every time you go to your sister's house. It might be, it could be something that's like simple as like obstructive sleep apnea. Maybe you're not getting like a restful sleep. Maybe you're waking up gasping all night. But a lot of the time, a migraine is an underlying condition for something else. Something's off. Something's imbalanced. And usually when you get things balanced, it's better. And it can run in families too. It could be your mom always had this problem, and now you're having this problem, right? But don't forget, it could be intolerances to food. So if you're going out and you're having something different, it could be a wine intolerance, alcohol, whatever. Your body is talking to you. So listen to your body. Make sure that you are getting right on top of it as soon as you possibly can. And if you're a person who is having migraines over the age of 50, you never had a headache before, headaches are just not going to go away, nothing's getting rid of it, be sure to talk to your healthcare provider so you can get some imaging if need be.
Can they be hereditary?
They can run in families, not necessarily hereditary, but run in families. Okay? All right, you guys. Thank you.
Thank you.
Thank you.